Greszler, you are now recognized by WebEx for 5 minutes.
Good afternoon, and thank you for the opportunity to be here today. As a wife and a mom of 6 young kids, ranging in age from 3 to 12, I've spent the last 13 years navigating the same thing that millions of parents have done in facing the decisions to determine what work and childcare is best for them. And if there's one thing that I've learned, it's that there's no single work-family balance nor childcare setting that's best for everyone. These decisions aren't easy, and I know I continually question whether we're doing the right thing. Only through the ability to carve my own pathway and achieve a flexible balance have I become more comfortable and confident in the choices that we've made. Families need to be free to pursue what's best for them and not what politicians, government programs, or societal norms tell them to do. I'm actually optimistic that the changes brought on by the pandemic could benefit families through more flexible and accommodating work options. Women have already overcome what were initially disproportionate employment impacts, and a recent study actually found that childcare struggles is no longer weighing on employment declines. That means that heavily subsidized childcare and universal pre-K won't solve the current employment problems, but they would push more parents into the workforce. And that's one of their goals, to prevent parents from having to give up income in order to stay home with kids. Allegedly, government programs are great for kids, producing 7-for-1 returns, but are politicians really telling me that my children's future value to society will be multitudes higher if other people pay for my children to attend full-time, government-directed childcare than if I or my husband give up some income to stay home with them, or if we choose any other combination of non-government childcare? It's wrong to discount the enormous value of parents investing time in their children. And moreover, there's actually zero evidence that large-scale government programs could mimic the high returns of tiny boutique programs that served disadvantaged children a half-century ago. Present-day programs like Head Start and Tennessee's voluntary pre-K program have provided little or no lasting gains, and they've had some consequences. Moreover, only 18% of families prefer to have both parents working and their kids attending paid childcare, and those families are disproportionately wealthy and affluent. Nudging families away from their preferences could backfire, as Quebec's $5 per day subsidized childcare program showed. It did increase work among young moms, and it shifted a lot of kids from family care to government care, but researchers found striking evidence that children's health and behaviors were worse off, they had higher crime rates as teenagers, and families experienced more hostility and less consistent parenting. There's also the reality that government childcare will drive up costs and limit choices. Requirements like extremely low child-to-teacher ratios and college degrees for childcare providers are a big reason behind DC's $43,000 price tag for 2 kids attending childcare. Small family and religious providers are usually less expensive and more flexible, but government subsidies and directives could actually crowd them out. Already, onerous government regulations contributed to a 52% decline in the number of small family providers since 2005. And while childcare is inherently expensive, there are ways that policymakers can help families obtain the care they need at a cost they can afford. My written testimony provides more details, but some helpful actions include letting families keep more of their own money, reducing regulations that don't contribute to improved quality and safety, giving more parents more choices with the public childcare programs that are out there, eliminating barriers to employer-provided childcare, letting workers choose to be independent workers, and enabling more flexible childcare settings. For example, Head Start costs as much as full-time childcare, but often only provides half as many hours. Families should be able to take that money to a provider that works better for them. If I watch my friends' kids one afternoon per week, I shouldn't have to convert my home into a licensed childcare facility. If a couple of moms want to form a co-op, they shouldn't have to become employees and employers of one another. And daycare shouldn't have to throw out expensive materials when a simple duct tape fix would do the trick. But apparently duct tape harbors germs, so it's not allowed. Caring for children is something that humans have done since the dawn of time. And childcare is not unique to COVID-19 or even to 21st century America. But as more Americans desire increasingly flexible work, easing childcare restrictions could help more families meet their desires. The solution to a more equitable economy is to empower parents instead of politicians to make the choices that are best for them. Thank you.